Welcome to part 3 of this series on psychological safety for pharmacy leaders. In this session, we are going to talk about the psychosocial factors that impact the level of psychological health and safety in a workplace. And we're going to tie in each and every one of them into community pharmacy practice to add some context and get you thinking about the opportunities that may exist in your pharmacy. I'm Amy Oliver, and I'm going to be walking you through this presentation today. I'm really excited about partnering with OPA on this series and look forward to hearing your feedback as you work through these important points in your pharmacies. In this session, we will be introducing pharmacy leaders to the 13 psychosocial factors that influence levels of psychological health and safety in the workplace. We will introduce and elaborate on the unique factors impacting healthcare environments, and we will provide a coaching framework for pharmacy leaders to think through the various factors and their relevance in their pharmacy practices. Take this chance to grab a pencil and a paper to help you reflect and jot down your ideas and thoughts throughout this session. There's going to be a lot of questions to help you reflect on your pharmacy practice and your pharmacy environment as we make our way through the different factors. Throughout this session, we are going to explore psychosocial factors in the workplace, which really means the way in which we work and the contexts in which we work, such as our relationships at work and the interactions that we have at work. Throughout this session, we will explore psychosocial factors. Specifically, psychosocial factors are the various things that impact the way we respond to work and to working conditions. And in some cases, the work we do and the working conditions that we're exposed to as pharmacy professionals can impact our psychological health. So these psychosocial factors related to work could include how we do our work, the deadlines, the pressures we experience, and the total workload we have, as well as things like the relationships and interactions with colleagues and supervisors, and even patients. There are 13 psychosocial factors that have been identified that apply to all workplaces. Additionally, there are 2 extras that are added on for healthcare practitioners and healthcare environments. Shortly, we will dive into these specifically and contextualize them for community pharmacy. We are going to touch on a lot, including what great cultures look like and what you need to know as a pharmacy leader about fostering employee engagement. Here are the key takeaways for pharmacy leaders on the various psychosocial factors that every pharmacy leader should know. When thinking about psychosocial factor number 1, psychological support, in your pharmacy practice, you can ask yourself whether pharmacy team members who are struggling with mental and psychological health are actually likely to get the help and support that they need. This could look like a pharmacy manager, a district manager, an HR resource, or other leadership actively supporting. So saying and doing things to help employees when they know they are distressed. It's possible that your pharmacy has measures in place to reduce the psychological impact or strain on its employees, which is great. We also have to remember that all pharmacy professionals we work with are dual-centric, meaning being a pharmacy professional is not their only identity. And this means they may have distressing issues in their life outside of work that could be impacting them at work. In these cases, how supported do your employees feel at work? While at first glance, this question may seem unnecessary, as pharmacists now receive training about various mental health conditions in their training and see patients with mental health conditions likely every day. However, that does not mean that the stigma around mental health doesn't exist where you work, and not all pharmacy employees are pharmacists. Many people are not yet comfortable talking about mental health. Many haven't learned as much as others about mental health. And additionally, like I said, the many non-pharmacists in your pharmacy have likely not received any formal training on mental health. So we cannot make the assumption that this is the case. The better question then might be, what can you do as a pharmacy leader to increase awareness and understanding of mental health in your pharmacy environment? We know that when employees are getting the psychological support they need, that they are more engaged in the work they do. They're more likely to be retained in our pharmacies and in our profession, and their overall performance goes up. And so this also means that when we don't have it, people miss more work, people have more conflicts, and people see more employees leaving their workplaces. And what is becoming more and more apparent throughout the COVID pandemic is that people are also choosing to leave the front lines and even the profession altogether. So now that you are thinking about psychological support in your pharmacy practice environment, you may be asking, so what can I do to make this better? Here are a few suggestions. First, make sure talking about mental health is not a taboo topic. People should feel like they can talk about mental health without fearing that they will be discriminated against. Next, you can provide access to mental health resources. This can look like coverage or therapy and professional support through benefits or employee assistance programs. It can also look like having a list of phone numbers that they can reach out to, like a crisis line, if things get particularly challenging. Also, training. In pharmacy, we see so much focus put on improving your clinical skills, staying up to date on the latest guidelines, but we put little emphasis or allowable time on upskilling people on their power skills, sometimes referred to as soft skills, but I don't like the term soft. So how can you help people with interpersonal skills like handling conflict and providing feedback? You can encourage and facilitate peer support and also become aware of and implement accommodations for people struggling with their mental health. Too often, we see health perks and benefits, employee discounts for gyms, encouragement around healthy eating, all good things, but we see practices focusing on supporting the physical health of their employees, but not the mental health. I see pharmacy practices and businesses that invest in ergonomic keyboards or headsets or squishy mats to stand on to support employees' physical health. Again, all good things, but little focus at work on the ways that they can support mental health as well. Required mental health supports change over time and in the workplace context are relative to the demands placed upon an employee and their personal reserve of resources and coping abilities. Reflection step number 1. So reflecting on all the questions we shared around psychosocial support in your pharmacy practice. Take the next 45 seconds to jot down your thoughts on these particular questions. If you need more time, feel free to pause the video before carrying on. Next is organizational culture. Think about what is your pharmacy's organizational culture? And when we think about this term, organizational culture, we can remember that parts of it are visible and observable, right? These are the objects that you have around your pharmacy, the practices that you can see and feel in the routines that everyone is aware of and practice all the time. Then there are the stated and conscious pieces. So these are the beliefs, the principles, the values directly or indirectly stated in your work environment. And then there are also a lot of things that are taken for granted. These are the unconscious assumptions that people have in your environment that are perceived as universal, but rarely stated. Organizations are cultures, right? And although more than 150 definitions of culture have been identified, we know that the two main foundations of culture are sociological, meaning that organizations have cultures, and anthropological, meaning organizations are cultures. Like I said, often it has to do with taken for granted values and underlying assumptions, but really it can be described as the social glue that binds an organization together, the way people describe how things are done around here. And this culture affects the way that your members, your pharmacy employees think and feel and behave. Kreisberg shares 4 practices that lead to successful culture change. Number 1, articulate aspiration. So this really means we are analyzing the current culture and discussing throughout the organization what this looks like, right? We're thinking about what outcomes the culture that we have produces. Is it results in authority in rapidly changing industries, or agility and flexibility amid increasing competition, right? We want to be thinking about those external factors and gaining awareness around things like financial strains, changing scopes and priorities, or disruption in the market to help people better understand and connect to the need for changes. The second way is selecting and developing leaders who align with target cultures. So really, we know that leaders are a catalyst for change, and they have an important role in creating safe climates. So we can also look at recruitment to align with this and thinking about our incumbent leaders who are maybe less supportive of the changes that need to happen and the different ways that we can engage them and re-energize them through different types of training or education. We also know that even resistant people will often support change if they really understand its relevance and the benefits that they can expect from it and the impact that they will have personally to move the organization forward. However, sometimes we're going to see turnover. People might move on if they feel like their values aren't aligned anymore, it's not a good fit. And others may be asked to leave if they maybe put some of this evolution at risk. We also want to make sure some of these things are not a secret, right? We don't want to just dump them onto our teams and have them not know that it's coming. So we want to be spreading the word through conversation and networks, right? We want to know that the employees are recognizing that their leaders are talking about different outcomes and big changes. We want to make sure that they are able to see the ways in which it impacts them, the different behaviors that they're going to need, and having some of these conversations. Lastly, being a great leader means that we are collaborative and that we recognize the perspective of everybody in the room matters. And goal setting theory tells us that if we include them in the plans, if we include them in the discussions before we roll out big new changes or initiatives, that they're more likely to support them. So it's really important to make sure that we are engaging the teams to gain their perspective around the things that are changing. Fourth is reinforcing the culture change through organizational design. So the idea is that all levels of an organization or all the different people in your pharmacy practice need to be aligned, right, to have a strong culture. And performance management can be used to help make sure that people are shifting in the right way, but it's also important to make sure that we are really connecting to the people and trying to make sure that we're finding opportunities to align our values with theirs. Adam Grant is an organizational psychologist and professor at Wharton, and I love this quote from him. He says, "In cutthroat cultures, people kiss up and kick down. They protect themselves by currying favor with people in power and exploiting those without it. In supportive cultures, people speak up and support down. They protect people without power by raising problems to those with it." Beyond the benefits to the psychological safety and health of our healthcare providers, a healthy culture has also been shown to result in better patient safety outcomes and fewer adverse events and incidents. So think about how you can involve the pharmacy team to come up with ideas around how to improve working conditions, how to make information more available. In the accompanying toolkit for pharmacy leaders, you will see some coaching questions to help you reflect and feed forward into the future with a strong culture that embraces the importance of psychological wellness for your pharmacy team. Time to reflect on factor number 2. Here are some key questions to think through. How would you describe your pharmacy's organizational culture? What is taken for granted in your pharmacy organization? How would your team describe the way things are done here? And how aligned are the leaders in your pharmacy and pharmacy environment with the desired organizational culture? The third psychosocial factor is clear leadership and expectations. Essentially, in a pharmacy setting, this means we're asking, does the pharmacy leadership team communicate expectations with the pharmacy team? Does the team know exactly what is expected of them? And do they also know what success looks like? Or is that bar always moving? We have to remember as well that anyone can lead, regardless of where you stand or what position you have. You do not need to be in a formal position of authority to be a leader. That being said, if those who are in positions of authority embrace collaborative leadership, we see change management skills implemented to help people process and move through change. We see pharmacy staff who truly understand their contributions, their expectations, and they are provided with timely and effective feedback. Sean Acor has written some great books, and my favorite is one called Big Potential. And it's about this idea that by helping others achieve their highest potential, we as leaders are actually more likely to reach our highest potential. He says it's no longer about being faster alone. It's now about being stronger together. He goes on to say that we used to ask questions like, how smart are you? How creative are you? Or how hard do you work? But now the better questions for leaders focus on others and the ability to achieve exponential success. So some better questions are, how smart do you make others around you? How much creativity do you inspire in others? How much does your drive become contagious to your team? And how resilient do you make others? Great leadership also means facilitating ground rules and boundaries. It also means avoiding arguing our own positions without listening to others. Instead, we should be asking others to explain their positions and really gaining that perspective. It also means not taking the easy way out, so not changing our positions just to avoid a conflict or flipping a coin. We also want to discuss our assumptions, right? Framing matters. We need to make sure whether the stories we're telling ourselves are true or are they just assumptions. And that when we have these types of discussions, these rich, meaningful conflicts, that there doesn't have to be a winner and a loser, right? It's about trying to make a situation where everyone comes out ahead. As leaders, we also have to watch out for and help mitigate some of the risks to great group dynamics, such as marginalization. That means when some team members are maybe hesitant to contribute or may feel that their answers are discounted. Causes for this can be stereotyping, personalities, or similarity attraction impacts. Power and influence is also a risk. So some team members, which may include you, have more than their fair share of influence. And this can be caused by personal power, meaning expertise or knowledge, or positional power, so positions of authority. Common information effect is also a risk. So teams have a tendency to state the obvious by dwelling on information they all already share. And the causes can include that this is comfortable and it's easy. But we need to remember communication is most valuable in its ability to transfer useful knowledge and information. We need to watch for groupthink when teams accept a conclusion or come to a consensus without properly evaluating and debating, regardless of whether an individual member disagrees or agrees. And lastly, as leaders, we need to watch out for escalation of commitment. And this is when a team's behavior or choices begin to lead towards negative outcomes, but the group or the pharmacy team doesn't realign and adjust, and instead it just continues on because of the feelings of prior investments of their time and their resources. Take a chance to reflect on factor number 3. How smart do you make others around you? How much creativity do you inspire in others? How much does your drive become contagious to your team? How resilient do you make others? And how does your pharmacy team mitigate the risks of marginalization, power and influence, common information effect, groupthink, and escalation of commitment that we described in the last slide? The fourth psychosocial factor is civility and respect. Respect for others is rooted in our training as pharmacists. However, when pressures are high, when exhaustion is high, and when pharmacy team members feel like they can barely keep their head above water, or they have fear or resistance to expressing their emotions or concerns at work, we need to take a hard look at how we are performing on this factor. Generally, we see pharmacy staff members respecting the team, the pharmacy family that they work with every day. And I hope that's what you're seeing too. If you find there are disagreements, is your team using conflict management strategies to address and move forward? Additionally, the COVID-19 pandemic has brought a different dynamic. People have short fuses, and outside of your pharmacy team, you may find that patients are shorter with you, with many pharmacists, even reporting harassment by patients and the public. Take the next 45 seconds to reflect on these questions. If you need more time to write down your thoughts, pause the video here before continuing on. Number 5 is psychological job fit. Put more bluntly, are we trying to fit a square peg into a round hole? Right? We can't fit people into perfect little boxes. Everyone on our pharmacy teams are unique in their own way. This is part of being a strong leader, recognizing that not everyone is on the same level of skill or comfort. It means recognizing the value of interpersonal skills and the importance of creating opportunity for people to develop in more than just their clinical skills and more than their productivity skills. It means knowing what the different strengths and interests are of our pharmacy team members and playing to those strengths. This factor also leads us to ask, does your pharmacy team find true meaning in their work? And how do you know? How can you find out? We talked about the quest for meaningful work in the OPA podcast series on professional wellness, so check that out too if you haven't had the chance yet. We have to recognize that it's hard for a lot of people to come forward and admit that they just aren't feeling it anymore. That new marriage spark with the profession isn't there anymore, and maybe they're exhausted. And like all types of relationships, you can really deeply love your work until you don't love it anymore. And if we let these people who are no longer deeply engaged in their work, who no longer wake up every day looking forward to work, carry on in the same way, we'll lose them from our teams. We need to find ways to re-engage them. But remember, only they can decide what meaningful work looks like. So don't force them into boxes. Ask them how you can support them finding more meaning in their work, and be open to ideas on how to align their roles and practices, even some of the time, with their passions. We as leaders need to create opportunities for our teams to lead with and live with their values. So circling back to what we've shared in factor number 5, use these reflection questions to think it through in the context of your pharmacy. What opportunities exist in your pharmacy for those pharmacy employees to work in a way that's aligned with their strengths, their capabilities, and their interest levels? Are they finding meaning in the work that they do? How can you find out what meaningful work looks like to them? And do you, as a pharmacy leader, create opportunities for your team to practice in a way that's aligned with their values? growth and development. In pharmacy practice, we see a lot of emphasis on professional development that is clinical or pharmacy practice based, such as new guidelines, new medications, and new skills like injecting or point of care testing. What we rarely see are pharmacy employers investing in the development of their team's interpersonal and emotional skills that help them thrive in a stressful and ever-changing pharmacy environment. Unlike many other industries, outside of a chain environment, it isn't always easy for pharmacy team members to see opportunities for promotions or advancement in their work. Consider how you can create in your practices and how you can support people to continue to advance through development in the context of your pharmacies. Can they take on pharmacy management roles, leadership roles, or champion particular services? Maybe they can become the change management leader or lead of that social or community investment initiative. A bit of creativity and commitment to developing your team beyond their clinical skills is a great way to work on this psychosocial factor. The future of work requires many employees to upskill or retrain to meet the demands of changing roles. Change can have an impact on stress levels, and many employees can benefit from a proactive approach to career development to provide insight into how the job market is changing and plan accordingly. There are a number of pillars for growth that we can consider related to this factor. One is a continuous improvement mindset. This means a culture that builds in continuous improvement processes where there's ongoing improvements of products, services, or processes through incremental and breakthrough improvements. And this is important to set the foundation for frequent feedback. Creating systems and processes that encourage continuous improvement can normalize agile operations where feedback is normalized as a way to strive toward excellence. We can build curiosity, so encourage all employees at all levels to ask questions and be curious about the services and the products that are offered. Be curious about themselves and how they can learn and grow, and also about each other and how to improve the team dynamics. Start small. Every step counts. It's important to break actions down to small steps so people can be celebrated for every bit of progress and build that momentum. It's one thing to finish a project and feel really proud of its accomplishment, but if it's not celebrated early and frequently, it's possible to miss the mark. Bi-weekly or monthly retrospectives can help teams focus on the small details and celebrate the small wins. Next is more positive feedback. Here we can try to focus on more positive feedback rather than only corrective feedback. And as mentioned, positive reinforcement is helpful to sustain long-term learning. Next is praise effort. We want to focus more on the effort of the person rather than simply the task. Someone who's trying really hard and wants to change is much more likely to see the results. We need safety to make mistakes. Psychological safety is important to build a feedback culture. Psychological safety is about being able to share parts of ourselves without fear of negative consequences, like losing our job. So people can be vulnerable and take risks and still be accepted and respected. Responsibility and accountability. Effective feedback cultures instill personal responsibility and accountability. People are responsible for their behavior and following through on any changes to how they provide feedback or follow through after giving or receiving feedback. Next is stay focused on the common outcome. So feedback cultures can also support each other by staying focused on the common outcome and the desired benefits, rather than getting caught up on all the individual nuances. The people in the culture recognize and act in alignment with collective benefits. We sum up these thoughts around Factor 6 in the following reflection questions. How can you support pharmacy employees to continue to advance their role in your pharmacy? What opportunities exist for them to champion certain services or own a portfolio or initiative? What are some of the non-clinical skills that your team would benefit from in order to keep up with a changing pharmacy practice environment? And how can you incorporate positive feedback cultures in your pharmacy? Factor number 7 is recognition and rewards. How can you start to incorporate genuine and purposeful appreciative feedback into the daily and weekly routines in your pharmacy? So, although pharmacy professionals surely want to be fairly compensated for the work they do, we also need to recognize that there's more to recognition and rewards than simply paying someone's wages. In your pharmacy, does your pharmacy team receive explicit expressions of appreciation from leadership, from other staff members? How can you start to incorporate genuine and purposeful appreciative feedback into the daily and weekly routines in your pharmacy? And I say daily and weekly because timeliness of feedback matters in order for it to be effective. On wages more specifically, one of the major complaints I hear across jurisdictions in pharmacy practice is that we're not fairly compensated for the work that we do as pharmacy professionals. Now, pharmacists that share this are generally referring to public compensation, such as the professional fees for flu shots or minor ailments, and that's fair. I think there's space for improvement that are more in line with the value you provide as pharmacy professionals. One thing that is interesting, though, is that when pharmacies are increasing professional services and they are paid either by the public system or cash paying patients for non-publicly funded services, we don't always see an increase in earnings filter down to the pharmacists conducting that said service. So while we spend time asking the government to pay us for our work, what we're worth, what can we do to internally dive into your pharmacy practice and assess whether you're asking your team to similarly do more for less? Thinking through these points in Factor 7, consider the following questions over the next minute as you jot down your thoughts. Does your pharmacy team receive explicit expressions of appreciation from leadership and other staff members? How can you start to incorporate genuine and purposeful feedback in your daily and weekly routines as a pharmacy leader? And are pharmacy professionals being constantly asked to do more without a clear answer to what's in it for me? Psychosocial factor number 8 is involvement and influence. Collaborative leadership means that as leaders, our roles are to seek the perspective of others, encourage healthy debate, and come up with creative solutions that meet the interests of all parties, rather than solutions where someone comes out feeling like a winner and someone else comes out feeling like they lost. Okay, and like I said before, goal-setting theory means if people are involved in making the plans, they are more likely to work hard to deliver on the plans. Is your pharmacy team engaged in discussions and decisions about how new services will be rolled out and about what they need to be successful? Are they all engaged in the decisions about how your team will deliver care and what changes are necessary to continue to move the practice forward? Take this chance to reflect on Factor 8, thinking specifically about how involved are the frontline pharmacy professionals in your pharmacy with setting goals and plans for the pharmacy. And what additional ways can you gather their perspective before making changes to the practice? Psychosocial factor number 9 is workload management. This is currently a really difficult factor in pharmacy practice. Pharmacies have been busier than ever before during this pandemic, and the to-do list is seemingly never ending. Here are some key questions to assess the workload management in your pharmacy. Are your pharmacy team members able to complete their responsibilities and tasks before the end of their shift? Does leadership believe the workload of staff is reasonable? Do the staff believe their workload is reasonable? Are pharmacy teams able to complete cognitively demanding work without interruptions? And does your pharmacy have documented strategies to deal with exhaustion, fatigue, and burnout in staff members? This is a really relevant topic to pharmacy professionals right now, so I think this is important to say as we explore this topic on psychological safety. Other factors affecting health include some of the roles and responsibilities of the job, the position in the hierarchy of the organization, and the conditions of employment. Workplaces where pharmacy professionals experience stress related to precarious employment conditions are more likely to have poor health outcomes themselves. Healthy workplaces are not just about complying to health and safety standards, although that's the minimum. It's about creating an environment for your pharmacy employees to thrive. Psychological safety is an important foundation for any of your wellness initiatives to succeed. Employees must feel safe to bring up concerns with their leader without fear of negative consequences of self-image, status, or career. Do your employees feel this way? Take the next 45 seconds to reflect on the questions we just outlined in this factor. If you need more time, again, jot down your thoughts by pausing the video before moving on to the next factor. Factor number 10 is engagement. So what is engagement anyways? I like to describe it this way. The first characteristic of engagement is energy and resilience. So this means enthusiasm to keep on trying even when work is challenging. Next is pride. So dedication, involvement, and having that sense of meaning and significance of the work that you do. And last is absorption. So enjoying work so much that you lose track of time. David Zinger says, employee engagement is the art and science of engaging people in authentic and recognized connections to strategy, roles, performance, organization, community, relationships, customers, development, energy, and well-being as we leverage, sustain, and transform our work connections into results. So why is employee engagement important anyways? Well, we know that increased engagement drives better results, and that Gallup suggests 20% or better boost to productivities and profitability in companies with high engagement. And some other statistics include that 30% of American workers and 13% of global workers are engaged in their jobs. That's not a lot. One typical approach to employee engagement is surveys that help rate levels of engagement in an environment. These surveys ask various types of questions to help people rate their own level of engagement. If we assume that people are responding honestly, then maybe we'll get some good input into the employee attitudes. We also know, though, that employees and what they think have a lot of value, but the data is challenging, right? A lot of times there's bias built into it, and sometimes people tell us what they think we want to hear rather than what we really want to hear or what they really think. So we need to be careful to check for bias in these types of self-assessments and think about, what we're seeing around employee attitudes and perceptions, and make sure that we're really getting some of that objective data that measures employees' actions. Here's some building blocks for employee engagement. Get employees involved in the process of planning and determining and measurements of success. If employees are part of the process to formulate results, they are more likely to stay accountable to achieving those results. The key to motivation and engagement for knowledge work is to make progress every day, right? Structure work so that progress is visible. Celebrate small wins and recognize employees for their progress. By showing employees they're appreciated, this can reinforce employee commitment to strategic goals. Our work is social, and we want to connect with others to share ideas. Introverted or extroverted, we all have varying degrees of interdependence on each other to get our work done. Beyond just getting the work done, engagement is about formulating and maintaining a strong network of relationships. Some people feel more connected to their work when there is a purpose or mission that's greater than themselves. This isn't true of all people, but for some individuals, having a purpose and knowing their why for working can help them feel connected to the work and therefore more engaged. If managers and pharmacy leaders can make the work meaningful, it will engage, sustain, and enrich their people. People like to feel also that they are capable and competent in their job. So providing training and development opportunities to support individuals to grow in their jobs and maintain levels of capabilities and competencies as their jobs change can help with confidence and self-esteem related to their performance. Leveraging employee strengths can energize people and improve team dynamics. This plays into the mindset that people like to feel capable and competent in their roles. And overall, when there's a healthy culture in an organization, employees are more likely to experience a better sense of well-being. This can help people feel more connected to their work rather than being worried about interpersonal stress that can impact their ability to perform in their job. Seeking to have employees leaving the day enlivened rather than depleted. Pulling together these key questions around Factor 10 on engagement, take a moment to ask yourself these questions and jot down your thoughts. Does your team have enthusiasm to keep trying, even when things are challenging? Beyond employee engagement surveys, what ways can you find out how your pharmacy team is feeling about working there? And what are some additional ways that you can foster relationships and networking for your pharmacy employees? The reality is that pharmacy professionals are dual-centric. And so this makes Factor 11 challenging. Factor 11 is on balance. So dual-centric means that pharmacy professionals identify with both their home life and their work life. And balance is a tough word and arguably hard to achieve. Perhaps a better word here would be work-life harmony, meaning can your pharmacy team meet the demands of both their work lives and their home and personal lives? Or does their role or identity as a community pharmacy professional start to override their responsibilities as an individual? Some important questions to ask here as you reflect on your practice are, does your team feel like they have appropriate balance or harmony between their work and personal lives? Is your answer an assumption or a fact, and how can you find out? Additionally, does the leadership teams in your pharmacy environment lead by example? Meaning, do you as a leader take time off? Do you shut work off at least some of the time? Regardless of what you say you support, if you aren't leading by example in terms of finding balance, people will not feel like they're able to work like this with your approval. Boundaries are important as professionals because there's always going to be more to do and more that you could be doing. It's important to set boundaries for yourself, to protect yourself from burnout, and to maintain proper balance between your lives as individuals and your lives as pharmacy professionals. Look, people don't have to like your boundaries. They only have to respect them. We need to shift the organizational cultures in Western societies that often correlate long working hours with commitment and performance. Because you can be a fantastic, caring pharmacy professional and still have boundaries around how much of yourself you give to the profession. So giving some structure to these questions around factor 11, take a moment to reflect on the following. Does your pharmacy team have control over their schedule so they're able to meet the demands of their work life and home life? Does the leadership teams in your pharmacy environment lead by example? And do they shut off periodically and take vacation? In what ways as a leader do you encourage your pharmacy team to set boundaries? And to what degree are the boundaries of your team respected? For example, are we texting or phoning them when they're not at work, and even if it's not an emergency situation? Factor number 12 is psychological protection. So questions we ask in this space are, is the psychological safety of your pharmacy team ensured? This means, are the supervisors, managers, and organizational leaders aware of the emotional state or well-being of the pharmacy staff? And are there pieces in place to help prevent harm and threats to staff? Some examples could include issues with patients and the public, which have increased during COVID. Meaning, are there systems and understandings that exist around when it's okay to refuse or discontinue service to a member of the public, or potentially when to call security or the police? And from a skills perspective, are your teams supported and trained in handling difficult conversations and conflicts? Take a moment to reflect on the questions we just shared for Factor 12. Again, pause the video if you need more time before continuing. Factor 13 is protection of physical safety. So in pharmacy practice, this can look like availability of PPE during a pandemic, appropriate support systems in place to protect staff from violence, from patients, from coworkers, or even from family. Can your team do their jobs in a physically safe way? This could look like ergonomic support. Does your pharmacy respond effectively when physical risks are identified, or only when physical accidents actually present? Factor 13 we've summed up in the following questions. Take this chance to reflect. So that's an overview of the 13 factors that really apply in all different work environments. But as I mentioned, there are 2 extra factors that are exclusive to healthcare environments. The first one is protection from moral distress. Moral distress in pharmacy practice appears when our pharmacy teams feel like they are unable to practice in a way that is aligned with their personal and professional value systems. This presents in 2 key ways in healthcare practice. One is the patient safety perspective. A lot of attention and systems have been built to ensure patient safety and safe reporting around medication and patient incidents. We often may spend so much time trying to make things right for the patient who was impacted, and also a lot of time reviewing the system and conditions which contributed to the incident, that we forget or don't spend enough energy on the person who made the mistake. They are the second victim. They need support and they need care. The other side of moral distress is the ethical perspective. So moral distress or injury can occur when the belief of how to care for a patient is not actually aligned with institutional or regulatory constraints. Let's dive into a few examples to give this some context. Some ethics examples that cause moral distress are, first, an example would be medication shortages are rampant, right? And you have to make active decisions sometimes to prioritize one patient over another when they both need a certain drug. That can be something that causes moral injury. Here's another one. If you truly believe a patient is in severe pain and their partner sold their hydromorphone for money, your moral decision may be to treat their pain, but your moral behavior does not follow through as it's against the rules to release narcotics early without approval. Here's another example. A patient you believe should have been prioritized for COVID vaccines was not yet eligible, and so you had to turn them away and ask them to come back when they were eligible. Another is a patient cannot afford a medication that they truly need. You don't have decision-making authority to give it away for free or for less, or just allow them to pay later, so you do not dispense the medication as they cannot pay. And here's one last example. Certainly these are not all inclusive. Last example, a prescription is incomplete and you can't reach the prescriber. You don't fill it as you're at risk of insurance audits with incomplete prescriptions, and the patient must wait a few days for access to a medication they really need. Reflecting around protection from moral distress in your pharmacy is so important, especially following these couple of years in a pandemic. So take a moment to reflect on the following questions. In what ways do you support your pharmacy team to protect them from moral distress? Do your medication error or incident management policies and processes include steps, attention, and care for the second victim? And reflecting on your own experiences in your pharmacy, what are some ethical examples that may have contributed to moral distress in the past? And what could you do moving forward should the experience repeat itself? The second factor that is really unique to healthcare environments is support for psychological self-care. A professional workplace and industry environment that actively supports pharmacy professionals need to care for their own psychological health and safety. Here are some examples of how this could look in pharmacy practices. First, support and systems in place to help mitigate feelings of professional isolation. Next, the pharmacy leadership provides access to supports for psychological self-care. This could look like benefits for all staff, not just some staff, employee assistance programs, or permission and support to take time off to focus on one's mental health. Employee development can include content related to self-care. Leadership leads by example and cares for their psychological well-being instead of promoting a culture of overwork. You need to walk the walk, not just talk the talk. Feelings of safety around disclosing mental health and the state of psychological well-being without fear of consequences. We elaborate a bit more on fear of disclosure on the 8th episode of the Prescription for Professional Wellness podcast. So if you haven't had a chance to check that out yet, That's a great one for some additional context on that. The area of support for psychological self-care is also so important for pharmacy practice, especially as we see stunning rates of burnout and distress amongst our pharmacy professionals. So rather than think about your perspective, what do you think their perspective is? So would your pharmacy employees describe your pharmacy culture and leadership as one that encourages them to care for their own psychological self-care? And beyond that, how safe do you think your pharmacy employees feel around reporting and discussing personal struggles they may be having with their psychological health? Thanks for tuning into this session on psychosocial factors that impact psychological health and safety in pharmacy practice. You can find supporting tools, coaching reflection questions, and more in the accompanying toolkit provided with this 3-part series. And lastly, thank you to OPA for sponsoring this session and for your commitment to the professional wellness of the pharmacy community.